Guest of the day is a dietitian. As the obesity epidemic is rising to astronomical numbers, she will be dealing with more and more clinical cases of non-alcoholic fatty liver disease. So, let's give a warm welcome to Miss Jody Beth Wells.
Hello, Cyber World.
Hi. So, Jody, please inform Cyber World to how we can possibly prevent or just treat the disease.
The best way to prevent non-alcoholic fatty liver disease is to stay healthy. Like you said earlier, Jessica, looking healthy doesn't always equal being healthy. Your insides are important, so take care of them. Exercise is very important, but you don't have to be able to run a marathon to be healthy. Try getting out and walking around your neighborhood, taking the stairs at work, or basically just staying active. You know the old saying, a body in motion stays in motion. Well, that's definitely true when it comes to non-alcoholic fatty liver disease and other diseases like diabetes and heart conditions. The key rule to exercise is to push yourself a little at a time. Start with something you know you can do and gradually increase the intensity. Even with a weight loss of 5 to 10%, we've seen increases in health and even prevention of some of these diseases. So for a 180-pound woman, that's as little as 9 pounds of weight loss. Eating healthy is also a great way to reduce your risk of developing diseases like non-alcoholic fatty liver disease. Like with most healthy diets, we want to avoid eating takeout and fast food. These foods are jam-packed with sodium, saturated, and trans fats. The bad ones we don't want. The further a food is from its natural state, the more unhealthy stuff it's going to have in it. When trying to prevent non-alcoholic fatty liver disease, I try to lead patients towards foods that have soluble fiber, the kind that helps with heart disease, polyunsaturated fat, which is your omega-3s, and complex carbohydrates.
Wow, Jody, that sounds pretty technical. Tell us more about the foods that have fiber, the good fats, and the complex carbohydrates in them.
Yeah, it all sounds a little intimidating, but it shouldn't be. These foods are easily found in your local grocery store. Look for products like Benefiber that offer a convenient way to add soluble, the good fiber, to all your meals and even your drinks. Foods with lots of yummy fiber are things like oatmeal, many types of beans, apples and citrus fruits, even carrots and peas.
Well, that sounds good. Okay, what about those good fats, polyunsaturated? Where can viewers get them?
Polyunsaturated fats are easy to find. Most types of fresh fish will be full of good fat. A lot of people get polyunsaturated fat in plant-based foods and cooking oils. Herbs like fresh basil, dried oregano, and even some thyme can offer us some of these good fats. Also look for products like Smart Balance and Jif. They offer products that are full of omega-3 fatty acids.
Yeah.
And those complex carbs I mentioned, those are in a lot of foods like whole grains, fresh fruits, vegetables, soy milk, low-fat milk, and low-fat yogurt. Vegetables that are loaded with this good carb are things like potatoes, yams, corn, broccoli, cauliflower, even carrots and onions, and especially your leafy greens.
Yeah. Well, Jody, a lot of my viewers are interested in the holistic approach in treating disorders. Is there any foods, supplements, or herbs that our viewers can take in?
Well, Jessica, the reason we turn to foods and supplements to treat non-alcoholic fatty liver disease is because there just aren't a whole lot of good medical treatments. Some studies have suggested that patients with type 2 diabetes can use their regular medications to assist in preventing or slowing the progression of non-alcoholic fatty liver disease. Those medications would be things like metformin and pioglitazone. Now, these medications are a lot like any other medications. You're going to have side effects.
Right.
Pioglitazone, it does good things for you too. It can help raise HDL, which is your good cholesterol, and it can help lower triglycerides. But it can also lead to fluid retention. And some cases have found that it actually will inflame the liver. But that's very rare, and you should always talk to your doctor first.
Of course.
Now, metformin, the other medicine that can be used with diabetes patients to help assist in reducing their issues with fatty liver disease, it can cause muscle pain and weakness, which encourages people not to exercise, which is very important with all your medications to remain active and eat healthy.
Right.
So, but sometimes non-alcoholic fatty liver disease can be treated with a liver transplant, but that's only when you've reached the end stage of the liver disease, and it's always a last resort.
Yeah, right.
The main item you want to focus on, Jessica, is vitamin E.
Oh, vitamin E.
Yes, we've all heard of vitamin E.
Right.
Non-alcoholic fatty liver disease has been shown in several studies to be positively affected by vitamin E supplementation.
Okay.
Vitamin E decreases negative enzymes within the liver and can help decrease inflammation that comes with the unhealthy liver. So that is great news for us because vitamin E is easy to get. As a supplement, you can take it in a pill form, or you can find it in yummy foods like olives, almonds, cooked spinach, and even sunflower seeds.
Wow, Jody. Well, thank you so much, and the viewers as well as myself can be smarter eaters in combating or preventing non-alcoholic fatty liver disease. Thank you.